Hey, I'm Matt Cassidy. Today I'm going to be talking about percentage of tension to apply when applying kinesio tape for general knee pain. This is one of my favorite tapings. Prepping the skin is going to be the first thing you want to do. Just make sure that this tape sticks properly, but have had great success with this tape, specifically for knees. Great pair of kinesio scissors is very important, and I do highly recommend you have a pair in clinic. This first strip here, I'm going to cut about 8-inch strip there, and then this second strip here that's going to go below the knee is going to be approximately a little longer, about 9 inches there. You want to go ahead and round off the corners on both of these strips of tape that you're going to apply. This is a strip of tape that's going to go above the patella as well as below the patella. And the first strip is actually going to be applied above the patella. And as far as the percentage of tension, it's strong area there that can take a fair amount of tension and support, just like you would see in a knee brace or something along those lines. So I do tend to recommend you apply this with 50% tension on both strips here to really give it just a good snug support there. And patients really appreciate having a little more tension on this versus some of our other tapings that we do apply in other conditions that we treat for. So you're going to go ahead and split this paper backing in the middle, tear that across like so. And again, first strip is going to be applied with the knee straight and relaxed there, just in neutral. And the bottom edge of this tape is going to go right up against the superior border of the patella. So I'm going to start my little bit of tension. I'm going to have my bases or my anchors with no tension on them. So all of my tension is going to be in between my thumbs here, basically from there to there. So if you pull on this as strong as you can, that would be 100% tension. So if you back that off, that's going to be approximately, at about halfway is going to be 50% tension. So as I get this tension on here, I'm going to go and touch down on the skin, again, right up to the superior border of the patella. And then what I want to do is I want to give a little bit of a curve to this before I stick this down. And then I stuck this down, and then you can simply peel that paper backing off with one hand or do a two-hand technique and peel it off like that. So that is strip number one. Give a little rub to it, just get that adhesive to start sticking, and that should stick real well for you. And then for strip two, we apply this with about 30 degrees of flexion in the knee. And same technique that we did last time, just going to simply split this paper backing in the middle, tension coming from the middle. And that first strip was 50% tension, again with the knee. You could go even a little stronger if you'd like on this one. And then I want to do equal tension on this second strip. We're going to do about 50% tension. You could go upwards of 70-75% tension as well on these. Again, tolerates very, very well there. So all my tension coming from the middle. This time, top of the tape is going to go right up against the inferior border of the patella. And I'm getting my tape stuck, and I'm creating equal tension on both sides, sticking both down at the same time, and then no tension on that end piece or that base as you apply it down with a one-hand technique like so. Give a little rub to it just to make sure that that sticks well. And this is a great taping for general knee pain, patellofemoral pain, knee OA, things of that nature.